Welcome to Babel, Translating the Middle East, a podcast from the Middle East program at CSIS. Here on Babel, we take you beyond the headlines to take a closer look at what's happening in the Middle East and why it matters. This week on Babel, I speak with Michelle Nunn, the president and CEO of CARE USA. Michelle leads more than 8,000 people working around the world in crisis response, health and education access, gender equality, and climate change. Together, we discuss the unique challenges of Gaza's humanitarian crisis by contextualizing it among other global crises. Then I continue the conversation with Natasha and Leah Hickert to discuss how global attention on Gaza has affected the conflict and the humanitarian response, and whether sustained humanitarian engagement will translate into the day after. To translate some of what's happening in the Middle East, this is Babel. Michelle Nunn, welcome to Babel.
Thanks so much, Jon. It's good to be here.
You run the American branch of an organization that's done relief work for more than 75 years. Where does Gaza rank in both scale and complexity in terms of the things that CARE has done for all those years?
CARE has, as you say, more than a 75-year history in dealing with complex crisis, starting in post-World War II Europe. And over the last few years, we've seen everything from global pandemics to earthquakes and typhoons and cyclones. But I think Gaza is unique, and it is particularly a fraught crisis in many ways. And if you are a humanitarian, one way of describing it is humanitarians are not used to having an entire kind of wall around the place where they're trying to bring relief, right? So there's, of course, humanitarian access issues in Syria and Yemen, but there is literally a corridor with a very small entry point in which only a small amount of aid, which is also, sometimes you can't get through your tents, or sometimes you can't get through your walkie-talkies, or all manner of things that are considered at different points dual usage. In other words, fearful that there will be utilized for terror. And so this is a particularly difficult gauntlet for humanitarians to grapple with. A second thing is people can't get out. And so if you think about Ukraine, if you think about even Sudan, and each one of these crises is unique, and the, sort of difficulty of, you're not certainly drawing any conclusions around comparative suffering, but this is unique in that literally even people who have cancer and people who would ordinarily be able to potentially flee a situation simply can't escape. And then the third thing is just the threshold of destruction in a short period of time. And the number of casualties in the first few weeks, the total number of casualties of children, for instance, that have been killed is more than the combined of other conflicts around the world in the last year. And then the precipitous decline around issues of hunger, where you're going within months into acute hunger, on the verge of famine, in some pockets, probable famine. And then again, the scale of destruction, where you have 60% plus of actual homes that have either had destruction or destroyed, 80% of commercial buildings, the majority of hospitals destroyed, children not going to school over the period of now 300 plus days. So, all of that combined makes it a particularly vexing humanitarian crisis. And then keep in mind that also, I think over 280 humanitarian aid workers have been killed during the course of the crisis. So a really, really difficult set of challenges.
As you think about global needs, which are profound, how do you decide how large your efforts in Gaza should be?
Yeah, look at Sudan right now, a crisis that has been largely displaced from the headlines. And we have 25 million plus people facing acute hunger. You could go to Haiti, you could go to Yemen, you could go to Syria. And so there's a couple of things that happen. One is the global community does look at the threshold of scale. When I say the global community, I mean UN, humanitarian actors, the threshold of scale, and then a proportionality of funding that is declared necessary for each crisis. Humanitarian actors then work together to complement one another around that crisis. There are always crises that don't get as much attention, that don't get as much high enough percentage of that total threshold of funding that the UN declares is necessary. And we see crisis now, I would say those longstanding crises like Yemen, for instance, in Syria, where the threshold of funding is going down. And that literally means that rations of food is going down and families are having to face into that reality. So it's a combination of scale, acuteness, and the determination along the lines of issues of what we have a index around hunger, et cetera, that all goes into that. But there's also it's not entirely a science. CARE, for instance, has been working in Gaza and the West Bank for 70 plus years. And in a scale of crisis like this, given the media attention, et cetera, we would expect that we would have raised tens of millions of dollars. And in fact, we've raised much less from philanthropic sources. We probably are raising a tenth of what we might ordinarily expect because of the politicization of the crisis and the way that it's perceived. So each one of these crises is unique, and each one faces a set of challenges and a gauntlet of issues that we have to navigate.
When you talk about the politicization, and certainly Gaza has been a profoundly polarizing issue in the United States as well as around the world, has that politicization affected what you do in Gaza?
Only in the sense that we didn't, in those early weeks and in these months since, have some of the flexible resources that we might ordinarily have received from corporate or foundation or individual donors. And so the capacity has been stretched. We've reached over 600,000 people in different ways. It's everything from water or shelter to health. But I think it has affected our capacity to support our team with the flexible resources that are so often required in a humanitarian crisis.
Have you found that hostility to what you're doing in Gaza has affected CARE overall? Are there people who say, well, I used to give to CARE, but now that you're helping those people, I just don't want to have anything to do with them anymore?
I have not confronted a humanitarian situation that has drawn such a polarizing set of views and almost an inability to hold space for shared suffering, to recognize the suffering after October 7th, the enormity of the suffering of those whose families are being held hostage, and then also the enormity of the suffering of 90,000 people who have been injured and almost 40,000 that have been killed. It has been hard to hold space on both of the sides of suffering. And yes, there are a few individuals that have found that their particular viewpoints didn't include the capacity to advocate for a ceasefire, which is one of the things that humanitarian actors often do. And we also have found a lot of bridging donors that have been supportive of Israel and also want to support those who are suffering in Gaza. So we certainly have seen a variety of responses, but I'd like to focus on the ones that have been bridging.
How have your relations with the government of Israel been as you've tried to get assistance into Gaza?
Yeah, and we work through an agency that works with the IDF, which is called COGAT, which is a set of players that supports the humanitarian engagement of the IDF.
Led by a Druze, which is to say an Arabic-speaking Israeli.
Yeah. And in every humanitarian situation, we maintain neutrality and impartiality so that we can work with both sides. So we do have the capacity and have worked with and have met with COGAT and those that are required for us to enable our humanitarian access to get things through. All of that has to be coordinated. And it is, as we've said, a very vexing crisis. The humanitarian community, I think, has struggled with the difficulties of getting aid through and some of the difficulties of also navigating, for instance, everything from visas so that humanitarian actors have the capacity to come in and out of both Israel, the West Bank, and Gaza. So a lot of complexities and a lot of barriers and a lot of challenges, and we continue to navigate through that.
And do you have to work through Egypt as well?
We do, yes. And we work through Jordan, we work through Egypt. We have a set of partners and colleagues in Egypt that are bringing in relief through Egypt. So that's an important access point. And I will say that part of having worked in Gaza, for instance, for decades is that we have a network of local partners that enable us to secure and procure both the capacity for partners to deliver, for instance, health, mobilization of clinics, all sorts of ways in which we support a population that is having the enormity of, 500,000 cases of acute diarrhea in a population of 2 million people, almost 1 million people that have had some sort of respiratory ailments, all of that with a health infrastructure that's completely depleted and with the difficulty of getting medicines in. So that a part of what we do is work from within as well as bringing supplies from outside.
Could you describe a little bit more how you work with other organizations, both international organizations as well as organizations on the ground in Gaza? Is that sort of a pickup game? Is that just scaling up what existed before? And in that world, I know that CARE focuses especially on women and children. Do you just sort of focus on what you're good at and other people take other pieces? Or is there some other way that this is working?
Yeah, if you think about when a humanitarian crisis happens, and often they're lasting for decades now, so not always rapid onset, but in this case, there were actually a set of humanitarian players already bringing relief in Gaza. And so that has gotten scaled up. There's a coordinating body, often through the UN. In this particular case, UNRWA is actually an entity that has a longstanding history and has been an important player within the Gaza context for many years. And then, as you say, the different agencies take on different sectors and different initiatives based upon their core competencies. For CARE, one of our core competencies is around, for instance, maternal health. So we have a very strong focus on working with locally based partners. And we've had these partners for many years. So we have trusted relationships in which we're able to leverage resources and our capacities in that coordinated system to bring relief, both geographically and sectorally, that is a complement and hopefully enables the entirety of the community to sort of bring the highest threshold of relief possible. And just keep in mind that all of this is during a time of conflict and war. And as we've said, until there is a ceasefire, it is almost impossible for us to operate at full capacity as humanitarian players in order to be able to bring the kind of relief that is required for people who have been in 300 plus days of difficulty accessing food, water, and basic health provisions.
Are there any Israeli civil society organizations that are interested in humanitarian relief that you've been working with on your Gaza response?
Yes. So there are humanitarian actors. Israel Aid is an actor that actually has done humanitarian relief around the world. And they are not acting in Gaza, but they did act for the first time in their own country in the aftermath of October the 7th. And they've been trying to play a facilitative role with other humanitarian actors where they work, in Sudan or Ethiopia and bring some of their knowledge and expertise as a bridge. And there are other players within the broader Israeli context that do humanitarian work around the world that I think are potential builders of that sort of civil society that will be a part of bridging as we move forward into the long term.
Armies often learn lessons from fighting wars. I imagine humanitarian organizations learn lessons all the time from large-scale operations. What are the lessons CARE is taking from what it's doing in Gaza that are going to affect the way CARE works and problems around the world?
Yeah, it's a great question. And we often do, as you say, after-action reviews from humanitarian crisis. And this one will have plenty of lessons for sure. And also, as I said, some of this is a unique context. I think a couple of things. One is the importance of localized partnership and leadership. And certainly the humanitarian community has been leaning towards that sort of localization of engagement with humanitarian actors and the recognition that, as my colleague who leads all of our humanitarian efforts around the world sort of says, that the first responders are always the women and men of the community, of the neighborhood who are helping their neighbors, who are supporting their families. That's the first line of both resistance and resilience. So supporting them. And then there are local organizations. They can be a whole variety of, for instance, in this case, a lot of what I would call health provision agencies that now are bleeding into humanitarian response capacity. So they're finding new ways of delivering babies in a fashion that they have never done before because they had institutions and hospitals. They're delivering birthing kits to shelters where people might not be able to have access. And so those kinds of things are really critical to any humanitarian response, but in Gaza in particular, because we also have had difficulty getting people in and getting things in, we've had to really rely upon the local leadership and local partners. So I think that will be a feature of the lessons that we take away from Gaza is what can we continue to do to lean into that trend as we go forward? And then, I think there'll be hard lessons learned as we've seen. There were efforts because we couldn't get in the ordinary way, the transport through the gauntlet that has been set up around the border. There were, we're going to set up this humanitarian pier and we're going to build this kind of new way of approaching. We're going to airlift supplies and drop them into Gaza. None of that has been, and I think humanitarian actors said from the beginning, anything and everything that we're doing, we want to do, but those are not the most effective and efficient ways of getting aid through. And of course, that has turned out to be true. And there were some people who were killed by dropping supplies into Gaza. There were painful lessons learned about the difficulty of building a pier in real time in a conflict zone. And in large measure, we've moved away from that strategy. So I think some of the lessons learned will be lessons that unfortunately humanitarian actors have already been aware of, and hopefully we can continue to take those lessons into the future.
How does CARE think about the future of Gaza and the future of its work in Gaza? The violence will stop. The needs will be profound. Where does CARE's work in Gaza fit into that future?
We've had a 70 plus years of working in Gaza, so we are there for the long term. We are committed. I think people will rebuild their lives. Some of the things that we have to recognize are, as we've discussed, the threshold of destruction, physical destruction. Secondly, the psychosocial impact of the last 300 plus days, which on any population would be extraordinary and will be harrowing for people to continue to move through that, even as hopefully we can face into peace. We've had the deterioration of those sort of civil infrastructure that we all rely upon, the police force. We've had, I think one really big concern is even with the ceasefire, will be challenging to ensure that that it's not overtaken by gangs, that there are ways in which we can restore civil order and that you can have basic operations for things like schools and hospitals, et cetera. So all of that. And UNRWA, I think, is going to have to play some role in that going forward in the medium term, in the short term, and over the long term. So all of those things are, I think, on our list. I think one of the things that we focus on is women and girls and ensuring that they have the capacity to be a voice of leadership around the table for whatever goes forward in terms of the future of Gaza, both in terms of the resolution of peace and also the enduring governance of Gaza. So that's going to be important. And then if you think about just the destruction of businesses, part of this is as we support people, ultimately people are going to need the livelihood restoration that is going to be essential to the rebuilding of their lives. And so we will, and CARE always does, move what we call sort of the nexus between the immediacy of humanitarian response, where we may be delivering cash assistance or water or shelter, but also the continuing thread towards rebuilding people's lives, which can include their capacity for the restoration of their jobs, of entrepreneurship and small businesses, and all those things that go into restoring a community that has faced into the enormity of the destruction that the people of Gaza have faced.
As somebody who's worked in development for many years, are there slivers of optimism that you see about what the future might hold that people don't see? Or is there just a lot of hard work to get to a stable place?
It's so hard to find hope and optimism right now, I think, in this particular situation. And the couple of things to try and find it would be one, that oftentimes in times of war and conflict, the position of women and their leadership becomes more recognized and lifted up in a different way. And we see that in the wake of World War II here in our own country and any number of conflicts. And so there are strong, powerful women that are leading the way in Gaza right now in terms of the resilience of their families and communities. And I hope that there may be a set of turning points that allow for that leadership to be lifted up as we move forward. So that would be one hope. I think that a second is that I've been following along with a number of people that are proponents of peace and that have been longstanding advocates for peace in the region. And I think the sheer enormity of the destruction and the violence and the loss and the suffering may precipitate over time a movement towards the necessary peaceful resolution for the conflict that can endure. And let's hope that that is the case.
Michelle Nunn, thank you very much for joining us on Babel.
Thank you so much.
As Michelle Nunn pointed out, Gaza is not the largest humanitarian crisis in the world, but it is among the most acute, and it is certainly getting some of the most attention. What has global attention on Gaza done to the conflict and also to the humanitarian response?
In some ways, it's driven the Israelis more into a defensive crouch. I don't think Israelis have ever really, as a society, absorbed the idea that they're creating a humanitarian challenge in Gaza. There's a sense that they are fighting against a vicious foe, that this is what war looks like. Israel hasn't really fought a war like this, and the Israeli press continues to not report what the rest of the world press reports, which is the imminence of famine, the spread of disease, the inaccessibility of food and sanitary products and all sorts of things. You don't see that in the Israeli press at all. They feel they're fighting war. And I think that there's a way in which the fact that Israel is seeing a very different war from the rest of the world means that Israelis sort of don't get why much of the world is up in arms about what's happening, and much of the world just doesn't accept the Israeli conviction that, well, it's justified because we're fighting a war against a very implacable foe.
Yeah, I mean, first I think I need to comment on that first point. I suppose you're measuring the size of the humanitarian crisis by population, or maybe even area size, by absolute population, that is. But there were only 2.3 million people in Gaza before this started, and we're talking about an area that's about twice the size of DC. But I don't think that makes what we're witnessing today any less horrifying. I would actually argue it makes it more horrifying. We've now been hearing that 1.8% of Gaza's population has been directly killed during the war. By January, we saw the highest daily death rate, direct deaths from conflict, by the way. I'm not talking about disease, starvation, all of these other indirect effects of war, but the highest daily death rate of any other 21st century conflict. And that's not relative. Those are absolute numbers. 60% of housing stock has been destroyed, and we're witnessing catastrophic levels of hunger and starvation that are the highest ever recorded on the IPC scale. So this is sort of the famine index scale. And that's both in terms of number of people and percentage of the population. So this is very striking. You have hundreds of 1,000 to 2,000 bombs being dropped on densely populated areas. And just to give a little bit of context for the audience, in Raqqa, in the sort of the US offensive to retake Raqqa from ISIS, we probably used, I could count on one hand the number of times we used bombs like that. And this was a pretty dispersed population. And even that offensive was viewed from a civilian harm mitigation perspective as quite bad. So I think, what we're seeing right now, and Jon alluded to the fact that polio has emerged again, a disease previously eradicated, and should be terrifying for all of us to even ponder. And as Michelle said, it's completely cordoned off, or as we've said in other contexts, besieged. So people can't move. They are moving around. pretty much the entire population has been displaced multiple times. So I think the context, the reason that we're seeing such attention is partly that, partly the fact that humanitarians are telling us that this is the worst they've ever seen, and partly the fact that it's the United States seemingly overseeing all of this. This is a liberal democracy that's been finger-wagging at other countries for decades for human rights violations, sieges, bombardment of civilian infrastructure, etc., for many years. It's the United States that is unable to get Israel its ally, to get aid in, to get humanitarian aid in, to be able to vaccinate the population against things like polio. So I think that's the reason that you're seeing so much attention. Now, to your second point, I haven't seen that really affect the situation, as Jon said. It hasn't made things better necessarily. It's almost made it worse. And I don't know if you can attribute that to attention. I don't know if you can attribute that to the fact that the United States hasn't really seemed to use its leverage on Israel to improve the humanitarian crisis. But I haven't seen any kind of benefits to that attention as of yet.
Are there ways in which the attention paid to Gaza could build support for other humanitarian operations in the Middle East?
It should. I mean, I think what we're seeing, if there's any lessons from October 7th and what we've been seeing in the past 10 months, it's that we can't forget these other protracted crises all around the region. They're all interconnected, or at least they can be, and they have been in a very disturbing way, from Yemen to Syria to Iraq to Lebanon even. There is a way that all of these things can be interconnected flashpoints. And so there should be a lesson that we need to focus on these conflicts or prioritize at least stabilizing these situations. But I don't see that. I mean, I don't know what you think, Jon, but I haven't seen that learning happening. I see more of a doubling down in DC on sort of the Abraham Accords model, or the sort of elite bargains model for stability.
Frankly, I think there's a doubling down on the idea that the Middle East problems are intractable.
Yeah.
That is a money pit. You can pour infinite resources into the Middle East, and there will still be pain and suffering and extremism and terrorism and violence and all those things. There is a community that says we have to help everybody, and humanitarian principles are sacrosanct. But it feels to me that for most people who have completely forgotten about Sudan, have completely forgotten about Yemen and all the other issues in the region, including some of the people who are most vociferous about Gaza, right? I mean, I testified in September about Yemen, and people disrupted the hearing because they're upset the hearing wasn't about Gaza. And the fact is that Yemen at that time had 400,000 deaths and Gaza had 15,000 deaths. And the idea that the United States has a role to play in humanitarian affairs and humanitarian relief for conflict, I think is something that precisely the elites in Washington care about. But my sense is for most people in the United States, the problem is endless. It is not affected by U.S. efforts. And I think for a lot of Americans, there are some Americans who say, this reflects on us. This is our responsibility. Israel is our ally, and they're doing it in our name. But I think that's also an elite attitude. And I think when you get past elites in Washington, for a lot of people, they say, wow, the Middle East has been fighting from the time of the Bible. It's going to be fighting for another 3,000 years. Why are we even engaged? And to me, there's a part of the humanitarian environment that is pushing a lot of Americans to say, we should just really get out of the Middle East.
Do you think the sustained humanitarian engagement of countries like Jordan, Egypt, the UAE is laying the groundwork for their sustained engagement in Gaza's political and economic future?
Well, it could, because, of course, while the United States can turn away from a place like Palestine, the Jordanians and Egyptians can't. They have stakes there. They have resources there, and I think they're in it for the long haul. We are far away from having an Israeli government that is really engaging in the kinds of steps that will lead to Arab engagement in Gaza and the West Bank. The Israelis, I think, would like it to be now. They'd like the Arabs to save them from the challenges, and the Arabs won't do it. I think there's a bit of a standoff. And the question that the Arab governments have to make is, what's the optimal level of circumspection about engagement in post-conflict Gaza? When do you get to post-conflict Gaza? What should they do? How do they exercise leverage over the United States, over the Israelis? It's really hard to modulate. There certainly has been an effort to hold back, but I think that over the next 6 months or so, you're going to see this challenge between not wanting to endorse what Israel's doing, not wanting to legitimize what Israel's doing, but feeling that they need to act now to arrest a decline, because they're going to have to live with that in both the West Bank and Gaza, and the two are clearly linked in many, many ways. They're going to have to live with that for many years to come. And part of the reality is you certainly have changing politics in the United States. You may have changing politics in Israel. You're not going to have changing politics in the immediate term in either Egypt or Jordan. How you navigate that as an Egyptian Jordanian government, as a Saudi government, as an Emirati government, I think is really hard and gets to some of the hardest decisions about regional security, regional affairs that these governments are going to have to make for a very long time.
Yeah, you specifically mentioned Egypt, Jordan, and the UAE. I think these are countries with different interests and different kinds of leeway, right? I think for Egypt and Jordan, if there isn't some kind of political path forward for Palestinians, it's going to be very difficult for them to be any involved to a certain extent. But also financially speaking, they don't have all of the resources to deal with the reconstruction of Gaza, which is going to take years and cost billions of dollars. On the other hand, the UAE, I think, has more leeway politically and financially. Their population has been less vocal about what's going on in Gaza. And obviously, it's an oil-rich country with strong ties to Israel. So I could see them potentially playing a part, even in sort of establishing a political path forward. I haven't seen any indication that they really want to be directly involved at this time. And I think, Jon spoke to some of the hesitation on that at this very moment, because no one knows really what this is going to look like, even in the next few months.
But the Emiratis have a keen interest in how this plays out for Egypt, because the Emiratis have an interest in Egypt. Mm-hmm. There's an interest in the stability of Jordan. This really does create a web of regional security challenges. And for all that a lot of Gulf Arabs or Gulf Arab officials are not deeply committed to the Palestinian cause, they are committed to the idea of regional stability. And I think this is going to produce some really difficult challenges. The easy challenge, frankly, is an Iran challenge, because you can sort of know where it's coming from. You know its parameters. You have countries, including Israel, that are helping you understand it.
Yeah.
Understanding how a collapse in Palestine, a meltdown in Palestine, extremism, how all those things both affect Palestinians, but affect these neighboring countries and affect broader Arab populations, I think starts getting you into some very speculative territory. And I don't think we have any idea how that's going to play out. So it feels to me that I think the Emiratis have a different set of concerns and a different set of abilities than Egypt or Jordan, absolutely. But the difficulty of the choices they have, I think, can't be underestimated. I remember talking to senior Emirati officials during the Arab Spring. They were terrified about what might happen in Egypt and how that would affect the Emirates. I think that all these countries have to look at where this lands in Gaza and what happens to the future of the West Bank, and think about what happens to the future of the region. All these wealthy governments are interested in diversifying their economies, engaging with the energy transition. What's happening in Gaza is not only a huge distraction, it's a huge threat to everything that for them is strategically important. But if that goes the wrong way, then everything unwinds.
Right. And we can't forget, obviously, how important, logistically speaking, Egypt is, right? One of the sticking points in these ceasefire negotiations is who's going to control the Philadelphia corridor. This is the area, between Egypt and Gaza. and whether or not the Israelis will relinquish control of these areas, these border areas. So, I mean, I think that there's a lot of pieces in these negotiations that Jordan and Egypt is necessarily going to have to be a part of.
Thank you for joining me, Jon and Natasha.
Thank you, Leah.
Thank you, Leah.
Thanks for listening to Babel. If you enjoyed this episode, please subscribe to the podcast on iTunes or Spotify or wherever you listen to podcasts. You can find more analysis on this topic linked in the show notes on the CSIS website, and you can find us on Twitter at CSIS Mideast.